Welcome to the Deep Dive. Today, we're plunging into a world where innovation moves at, well, lightning speed. Medical science.
It really does. Keeping up is a challenge in itself.
Exactly. And specifically, we're looking at surgical and medical advancements, but also the critical challenge of ensuring that this groundbreaking knowledge actually reaches everyone, everywhere, quickly and ethically. How do we make sure that what's discovered in one lab, maybe a new technique, can swiftly benefit a patient, maybe halfway across the world, without all the usual delays and barriers?
That's the million-dollar question, isn't it? The bottleneck issue.
It really is. So our deep dive today is into a really fascinating initiative aimed at tackling exactly this: advancing excellence in surgical and medical scholarship, brought to life through the Genesis Journal of Surgery and Medicine.
GJSM, right.
And I should mention right at the top, this entire discussion is directly informed by a really insightful editorial note penned by Dr. Reza Lankarani. He's a general surgeon, the founder of the Surgical Pioneering Series, and also an editorial board member of the Genesis Journal.
A key figure in this space.
Definitely. So our mission today is to unpack how this journal aims to, well, revolutionize the sharing of critical medical insights, making it more accessible and truly global.
And what's fascinating, right, from that editorial note, is how it lays out this vision. It's not just about publishing papers. No, it's about genuinely democratizing knowledge in such a crucial field, especially now, with information overload being such a real thing.
Right.
And open access in science is just, it's more vital than ever for actual global health progress. It feels like they're trying to break down some old barrier.
Okay, let's unpack that vision then. Dr. Lankarani, as you mentioned, a surgeon himself and now on the GJSM editorial board, talks about a new era. So what is the core philosophy driving this journal? What makes it a new era?
Well, I think the Genesis Journal of Surgery and Medicine, GJSM, it's fundamentally committed to advancing global medical knowledge, yes, but it's the how that's different. The editorial really emphasizes things like interdisciplinary collaboration, radical accessibility. We'll probably get into that more rigorous peer review, of course, but also genuine inclusivity and a real drive for innovation.
So not just the usual academic checkboxes.
Exactly. It feels like a strategic response to, the traditional gatekeepers and the silos you often see in medical publishing. And Dr. Lankarani's background, as a surgeon, plus founding the Surgical Pioneering newsletter and podcast series, he's clearly dedicated to pushing surgical innovation through research and education.
Right, connecting the two.
Precisely. He seems to see the journal as a key channel for that, recognizing that progress doesn't just happen in a few elite places. It thrives when knowledge flows freely, ethically, and globally.
And you think that's especially critical now?
Absolutely.
Yeah.
Look at recent years. Medical challenges, pandemics, emerging diseases, they're inherently global. Our knowledge-sharing systems have to reflect that interconnectedness. The old ways are just too slow, too restrictive.
That's a really powerful point about how outdated models can actually hold back global progress. Something else that jumped out at me from the editorial was GJSM's very deliberate international editorial leadership.
Yes, the global mosaic.
Exactly, the global mosaic of expertise. How truly global are we talking here, and why is that specific strength so important, do you think?
Oh, we are talking truly global, and it's definitely not just symbolic. The editorial board, I believe it spans over 15 countries now, across 6 continents.
Wow.
Yeah, it's not just a token few, it's a vast network. The editorial mentions specific names: Editor-in-Chief Jeffrey Gross from the U.S., Professor Yopi Afrandi Habibi from Indonesia, Dr. Bor Rudi Noureddine from Algeria,
Okay.
Professor Odile Claudius, Australia, Dr. Liu Wei from China. The list goes on. It's this deliberate geographical spread that ensures a breadth of clinical experience, research perspectives, things many journals, even top ones, sometimes lack.
So it's not just names on a masthead.
Not at all. It's about integrating these diverse experiences, high resource settings, low resource settings, different healthcare systems, varied surgical traditions, right into the journal's decision-making, into what gets published.
So this diversity, it isn't just symbolic, is it? How does this global perspective actually enrich the journal and ultimately medical practice on the ground?
It enriches it hugely because it brings in perspectives that might otherwise be completely missed. Think about innovation. It could be in robotic surgery, sure, but it could also be in managing tropical diseases surgically or developing super cost-effective techniques in places with limited resources.
Right. Things that might not make headlines in, say, a Western journal.
Precisely. This global board means the journal is better equipped to identify, understand, and champion innovations that address truly global surgical challenges. It amplifies voices from diverse healthcare realities that might otherwise just go unheard. It fosters a kind of cross-pollination of ideas.
Can you maybe give us a concrete scenario? Like, where might a specific innovation from a low-resource setting have been missed by older models,
Right.
but GJSM's approach gives it a platform?
Okay, yeah, absolutely. Imagine a surgical team, maybe in a rural part of Southeast Asia or Africa, develops a really clever, low-cost way to perform a common procedure, let's say hernia repair, without needing fancy equipment.
Right.
In a traditional journal, often biased towards high-tech research from well-funded Western institutions, that paper might struggle. The reviewers might not get the context, might underestimate the impact because it doesn't fit their usual mold.
Mm-hmm.
But with GJSM's board, you have members from those diverse settings. They get the context. They understand the value of an innovation that addresses local challenges, but might also have global relevance, especially for cost effectiveness.
So they can champion it.
Exactly. They can champion it, contextualize it properly, ensure it gets rigorous review, but through a lens that appreciates its unique contribution. It ensures that potentially life-saving practical knowledge isn't lost just because of where it originated. It helps build a more complete picture of best practices globally.
That really paints a clear picture of the impact. Okay, so we've talked about who is contributing from around the world, how diverse that is. Now let's shift to what they're publishing. What stands out in GJSM's scope? You mentioned bridging specialization and practical use.
Yeah, the comprehensive scope with clinical relevance is key. It's broad covering, like over 30 surgical and medical subspecialties.
30? Wow.
Yeah, everything from, minimally invasive techniques, endocrine surgery, to perioperative pain management, surgical oncology, really the gamut.
So it's not hyper-specialized in just one niche?
No, and that's intentional. It positions the journal as a place for cross-disciplinary conversation. How does an advance in, say, imaging impact surgical oncology? How does pain management research affect recovery from minimally invasive procedures?
I see.
The editorial stresses, they're looking for research that translates directly, stuff that improves patient care, improves surgical outcomes, getting insights from the lab bench or the data analysis right into the operating room. That's the goal.
Can you give us a concrete example of that kind of translational work, where tech meets practice?
Sure. The editorial actually mentions a specific study on computer vision in laparoscopic cholecystectomy, gallbladder surgery.
Okay, AI in the OR.
Essentially, yes. Using AI, advanced imaging, to help surgeons identify critical structures, like the bile duct, during the procedure to prevent injuries.
Which can be devastating if they happen.
Exactly. Rare, but serious. So this is a perfect example. Taking cutting-edge digital medicine and showing its direct, tangible benefit for patient safety right there in the operating room. That's the kind of translational work GJSM really prioritizes.
And what about the types of articles? Is it just big studies?
No, and that's another point about inclusivity. They welcome diverse article types, original research, yes, but also technical notes detailing new procedures, case series, comprehensive reviews.
So different ways to share knowledge.
Right. This opens the door for, say, surgeons innovating in resource-limited areas who might have a really valuable case series showing a novel approach, but maybe it doesn't fit the mold of a big randomized trial that high-impact journals often demand. It amplifies more voices.
Okay, so this broad scope, this global reach, what does it all mean for the researchers and doctors out there? Especially those maybe without huge grants. Which brings us to accessibility. GJSM talks about removing barriers to knowledge. How are they actually doing that?
This, I think, is one of GJSM's most radical and powerful commitments. It's their steadfast adherence to open access.
Which means free to read.
Yes, free to read for everyone, everywhere. But crucially, they take it a step further. The journal operates under a policy of no publication or article processing fees for researchers worldwide.
Wait, no APCs at all?
None. Zero. Think about that. Traditional academic publishing often involves APC's article processing charges that can run into thousands of dollars.
Yeah, that's a huge barrier.
It's a massive barrier. It effectively shuts out brilliant researchers from less affluent institutions from entire countries, regardless of how groundbreaking their work is. By eliminating fees, GJSM ensures that merit, not money, determines what gets published and shared.
That really is a game changer.
It absolutely is. Research from a top U.S. university or a small regional hospital in Africa, if it passes rigorous peer review, it gets published and is accessible to the entire global community. No paywalls, no author fees.
And they use a specific license for this.
Yeah, they operate under a Creative Commons license, specifically CC BY-NC ND 4.0.
Okay, what does that mean in simple terms?
It means anyone can freely share the work, copy it, distribute it, as long as they give credit to the original authors, that's the BY, don't use it for commercial purposes, NC non-commercial, and don't make derivative works or adaptations, ND no derivatives.
So share freely, but respect the original work and don't sell it.
Exactly. It balances maximum accessibility with protecting the integrity of the research and the author's rights. It really aligns with that core mission. Knowledge should be free to save lives and inspire innovation.
That no-fee open access is huge. But you also mentioned speed. The editorial talks about a fast peer review process, something like 10 days post-acceptance.
That's right, approximately 10 days from acceptance to publication.
Okay, but some might worry, doesn't that speed risk compromising the quality, the rigor of the review? How do they balance speed and scientific integrity?
That's a fair question, and it's something the editorial implicitly addresses. The speed isn't about cutting corners. It's apparently about an incredibly efficient system.
How so?
Well, they use single-blinded peer review. Reviewers know who the authors are, but authors don't know who the reviewers are. This can sometimes streamline the process compared to double-blind. But crucially, they don't compromise on standards. The editorial explicitly states adherence to major international guidelines, ICMJE, the International Committee of Medical Journal Editors, and COPE, the Committee on Publication Ethics.
So, recognized benchmarks for quality and ethics.
Absolutely. These are the gold standards. The focus seems to be on creating a supportive, efficient ecosystem, especially helpful for maybe early career researchers or those for whom English is a second language, guiding them through a robust but swift process rather than letting good research languish in review queues for months or even years.
Okay, that clarifies the rigor aspect. So beyond just publishing the papers quickly and accessibly, how does GJSM handle the crucial areas of ethics and education in surgical innovation? It sounds like they're thinking holistically.
They really are. Their commitment to ethical innovation and education seems quite comprehensive. For any studies involving humans or animals, they mandate IRB Institutional Review Board approval. That's standard ethical oversight, but essential. They also align fully with the Helsinki Declaration Principles for Human Experimentation. Patient welfare is paramount. And they really emphasize informed consent, especially for things like case reports that might use patient images. Protecting privacy and autonomy is key.
So ensuring the science is ethically sound before it even gets published.
Precisely. It prevents the journal from inadvertently promoting research that might be scientifically interesting but ethically questionable. It grounds the innovation in solid ethical practice.
And does this connect to broader educational efforts, making the knowledge useful beyond just the paper?
Very much so. The goal is to publish papers that are technically sound, yes, but also clinically accessible. Bridging that gap between dense academic writing and the practical realities of the operating room or the clinic.
Making it teachable, usable.
Exactly. And these published resources are designed to complement other educational initiatives. The editorial actually gives a nod to the Surgical Pioneering podcast, which, as we mentioned, Dr. Lankarani founded as an example of extending this knowledge sharing into other formats.
So the journal is part of a bigger picture of learning.
Right. It's not just a static archive. It's part of a dynamic ecosystem. And the editorial gives credit where it's due, acknowledging that the journal's success relies on its authors, its reviewers, the editorial board, everyone contributing to this environment of mentorship, collaboration, and mutual respect in the global surgical community.
Okay, let's zoom out a bit then. Dr. Lankarani describes GJSM not just as a journal, but as a movement. That's a strong word.
It is.
What does that mean in practice? What's the next frontier for them if they see themselves as pioneering a movement?
Well, the looking ahead part of the editorial outlines some pretty ambitious strategic initiatives. They're not just planning to keep publishing, they want to expand their impact.
Like how?
For example, creating special issues focusing on underrepresented areas. Things like maybe AI and surgical planning, which is huge, or the challenges of global surgical equity getting care to underserved populations.
So proactively seeking out important topics.
Exactly. And they also plan to develop mentorship programs pairing early career researchers, perhaps from those resource-limited settings we talked about, with experienced surgeons on the board or in their network.
Actively building capacity.
Yes, nurturing the next generation, ensuring diverse voices keep coming through. And another big one is further multimedia integration.
All beyond just text.
Right. Think video abstracts showing a new surgical technique. Or maybe dedicated podcast discussions linked to specific articles, a bit like what we're doing now, making complex research more digestible, more engaging for a wider audience.
Making the knowledge truly come alive. It really does sound like a call to action. Dr. Lankarani ends his note with that powerful quote attributed to Lincoln. The best way to predict the future is to create it. What's the ultimate takeaway from that vision? What's the invitation here?
I think the takeaway is truly that call to pioneer together. GJSM, based on this editorial, seems to embody this idea. It's about fundamentally democratizing knowledge, actively celebrating diversity in research, and trying to redefine what medical literature can and should be in the 21st century.
So it's an invitation.
It absolutely is. An open invitation to surgeons, researchers, clinicians all over the world, especially those who might feel marginalized by the traditional system, maybe in resource-limited settings, to contribute their work, engage with the findings, and actively participate in shaping the future of surgical and medical literature.
Turning data into stories that save lives.
Exactly. Transforming data and experience into narratives that actually save lives, inspire real innovation, and drive meaningful change across the entire global health landscape. It's a challenge to move beyond old hierarchies and embrace a genuinely collaborative future.
Wow, what a truly inspiring deep dive that was. We've really seen how the Genesis Journal of Surgery and Medicine, guided by insights like those from Dr. Reza Lankarani, is working to redefine medical scholarship. Global collaboration, ethical innovation, that radical open access.
It really brings it all together.
And just to reiterate, this deep dive was created based on that editorial note by Dr. Reza Lankarani, who is a general surgeon, founder of the Surgical Pioneering Series, and an editorial board member of the Genesis Journal of Surgery and Medicine.
Indeed. And if you connect this to the bigger picture, you can see how this kind of commitment, accessible, diverse, rigorous knowledge, really could accelerate medical progress. And crucially, ensure the benefits are shared more widely, more equitably.
It feels like a potential model for the future, doesn't it?
It really does. It shows how dedicated people and platforms can start dismantling those long-standing barriers to knowledge for the good of global health.
So, for you listening, what does this all mean? Maybe consider this. In this age where medical knowledge evolves so rapidly, how might these principles, open access, global collaboration championed by GJSM, actually shape the future of healthcare for everyone? Including right here in your own community. It's definitely something to think about.
A powerful thought.
And if you want to explore more, to access additional details or check out the journal itself, you can refer to these links. First, Surgical Pioneer at surgicalpioneer.codedx.me. And the journal itself at genesispub.org, Genesis Journal of Surgery and Medicine. We'll make sure those are available.
Right.
Thank you so much for joining us for this deep dive today. We look forward to exploring more fascinating topics with you next time.